Anxiety is something almost everyone experiences, but few people talk about honestly, and even fewer people understand it properly. I'm Dr. Daniel Gordon, a GP here in London, and I've spent years treating anxiety, helping my patients through anxious patches, panic, and even severe anxiety disorders. And I can tell you from my experience, there's a huge amount of confusion, shame, and misinformation out there. So in this video, I'm going to give you a balanced, practical breakdown of 5 questions about anxiety that you may be too afraid to ask your doctor. Questions so many of my patients bring to me, often nervously, but they're questions that deserve clear, evidence-based answers. We're going to cover the difference between everyday anxiety and an anxiety disorder, why avoiding triggers can quietly make things worse, what actually helps to stop a panic attack, whether high-functioning anxiety is a real thing, and how anxiety affects your body and not just your mind. By the end of the video, you're going to understand anxiety a little differently, and hopefully you'll feel a little less alone. So let's jump in. Question number 1. What's the difference between everyday anxiety and an anxiety disorder? Now, as you know, I always like to start at the beginning, and this is the perfect opportunity to do exactly that. Because to understand anxiety disorders, we have to first understand that anxiety is normal. It's not a bad thing in itself. It's a normal, essential human emotion designed to keep us safe. Imagine, for example, that you're walking through a field and a bull suddenly turns to charge at you. You need some kind of system in your body to keep you safe. Your brain needs to sound an alarm so that your body prepares to cope with that danger. Your heart rate rises, your breathing speeds up, your muscles can tense, you start to sweat. That's your body preparing to run. And while getting confronted with a bull in a field is pretty rare, that same system can switch on during many triggering events in our daily lives. For example, before an exam, before a big meeting, a first date, or when you're waiting for test results. Now, in small doses, that physiological stress response actually helps us focus and perform better. But when that system misfires or stays stuck in the on position, when there's no real danger, that's when we start crossing into problematic anxiety territory. So when does anxiety become an actual problem? Well, I would say there are 3 main clues. The first is when your anxiety is triggered by everyday situations like crowds, public transport, work meetings, situations that aren't dangerous, but your brain treats them as if they are. Second, when anxiety becomes persistent, so you're anxious most days about many different things. You can't seem to switch it off, and even small decisions feel overwhelming. And third, when anxiety starts to interfere with your daily life, your work, relationships, ability to care for yourself or for your family. At that point, we may no longer be talking about a normal emotional response. We may be talking about your anxiety system misfiring. Question number 2. Should I avoid anxiety triggers to make my anxiety better, or will that over time make it worse? Now, this is one of the biggest traps I see people fall into. When something makes you anxious, say taking the tube, walking into a crowded event, the natural instinct is to avoid it. And to be honest, for a while that might work because you're not exposed to that painful trigger anymore. You can feel calmer and your anxiety drops. So it feels like you've solved the problem. But in reality, you've just taught your brain one thing. That situation was dangerous and avoiding it has kept me safe. So the next time that situation comes up, your brain sounds that anxiety alarm even louder. And before long, your ability to face that trigger starts to diminish over time. Maybe you stop going to parties, stop using public transport, stop seeing friends, stop going shopping on the weekends. And before you know it, your world has quietly shrunk down because you're avoiding those triggers. And that's the painful paradox with anxiety. The very thing that feels protective in the moment can then make it worse over time. Now, the alternative is something called graded exposure. So gently and safely facing your anxiety triggers in small, controlled steps, ideally with professional support. So for example, if crowds make you anxious, a professional might guide you through graded steps. Step 1, walking past a busy cafe. Step 2, standing in front of a shop for a few minutes. Step 3, going to a small event or a gathering of people. Each step teaches your brain that discomfort doesn't equal danger and helps tune down the anxiety response over time. Avoidance fuels anxiety, whereas exposure with the right support can retrain it, and that can be life-changing. Question number 3, how can I stop a panic attack? If you've ever had a panic attack, you'll know how terrifying it can be. My patients tell me it feels like they're dying. Your heart's racing, you feel dizzy, your chest tightens, you get short of breath, feel tingling in different parts of your body, and you can even sweat as well. Here's the truth. Panic attacks feel life-threatening, but they aren't dangerous in themselves. It's that body fight or flight system stuck in overdrive mode. So what actually helps in the moment? The most powerful long-term strategy we have is cognitive behavioral therapy, or CBT. A talking therapy that explores how thoughts, feelings, and our behaviors interact. For example, you can learn to spot anxious thoughts like, I can't breathe, I must be dying, and replace them with more compassionate ones like, my body is panicking and it will pass. You can also learn body-based tools like controlled breathing and attention anchoring, anything that brings your focus back to the present moment. But CBT and talking therapies aren't instant fixes. I compare them to going to the gym. You don't build strength in one session, you build it through repetition, consistency, and gradual change. Now, medications can also play a role in helping us avoid panic attacks, especially when anxiety is severe or disabling. Anti-anxiety medications called SSRIs, like sertraline or citalopram, can help reduce your baseline anxiety, making panic attacks less likely. But they're not quick fixes, and they usually take weeks to work. They can, however, be a valuable part of a bigger, more comprehensive plan to help you feel better. There are also short-term medicines that can calm panic rapidly, but we've got to be really careful with them, as some of them can cause dependence and are really best avoided unless absolutely necessary and prescribed by someone experienced. Finally, remember your everyday foundations: regular sleep, limiting caffeine and alcohol, daily movement and mindfulness. None of it's glamorous necessarily, but together they're the building blocks of stability. As I've discussed before, there's usually never one thing that works for mental health difficulties. You have to think of it like a toolbox approach, bringing together many different helpful strategies that work for you to keep you happy and well. Question number 4, do I have high functioning anxiety? Now, this one is everywhere online and it resonates with a lot of people. I actually think it's super common nowadays. We tend to imagine an anxious person as someone who looks visibly nervous, withdrawn, or unable to cope. But what about people who seem confident, organized, successful, yet feel that constant pressure and dread inside? That's what people mean by high functioning anxiety. It is not an official medical diagnosis, but it does describe a very real lived experience. You may be holding down a demanding job, looking after your family, and appear calm and capable, but internally you could be in turmoil, planning everything, overthinking, chasing perfection. So you're functioning, but you're functioning at a huge cost to your mental health and even your physical health as well. In classic anxiety, people often avoid triggers, whereas in high functioning anxiety, people can push through triggers, achieving more, saying yes to everything, while quietly burning out inside. And because it looks like you're coping, people rarely notice you're struggling, which can make it harder to ask for help because it feels like a failure even when it isn't. So what would I say to you if you're in that position? Well, as a doctor, I'd say you're no less deserving of help just because you're managing. Anxiety that hides behind like high functioning is still anxiety. And the treatments, CBT, mindfulness, healthy routines, sometimes medication and self-compassion can all still help. Question number 5, is anxiety all in your head or does it affect the body too? So I get asked this question all the time and the answer is simple. It's neither one nor the other. Anxiety lives both in your mind and your body because it's a biological response. So while your brain fires chemical signals, your body obviously reacts, which is why anxiety can cause such strong physical symptoms. For example, a fast heartbeat or feeling your heart beating in your chest, feeling tightness in your chest, feeling short of breath, dizzy, sweating, shaking, trembling, sickness, tingling in your hands or feet. These are all common symptoms of anxiety. And here's where it gets really tricky. Those symptoms are frightening. And the worry that the symptoms cause can feed your anxiety even more, which makes your symptoms even worse. So suddenly you can find yourself stuck in this cycle that feels impossible to break. And panic attacks are probably the most intense version of this, where the symptoms come on so quickly and peak within minutes and leave you feeling seriously unwell or even like you're dying. So no, anxiety is not all in your head, it's absolutely in your body too, and understanding that helps break the cycle. But there's another point worth saying here. Sometimes physical health conditions, like thyroid disease, for example, or certain heart rhythm issues, can share very similar physical symptoms and therefore mimic anxiety. So if you are experiencing new physical symptoms, it's always important to get them checked out so you can get the right help. Now, people often ask me, when is my anxiety bad enough to see a doctor? My answer is so simple. If your anxiety is making you miserable, confused, or affecting your life, you're never wasting your doctor's time by making an appointment. That doesn't automatically mean medication or therapy. If your anxiety is mild, it may just be a chance to talk, organize your thoughts, and explore what support may be right for you. But if your anxiety is more severe, affecting your sleep, work, or family life, your doctor can guide you through evidence-based treatments, whether that's therapy, medication, or lifestyle advice. You don't have to face it alone, and you're never wasting your doctor's time. So let's recap what we've covered today. Firstly, anxiety is normal, a normal human emotion, but when it's constant, uncontrollable, and impairing, of course it deserves help. Number 2, avoidance. It feels safe in the short term, but often it makes it worse in the long term. Number 3, panic attacks. They're terrifying but temporary. Skills like CBT, breathing and grounding can help rewire your response. Number 4, whilst high-functioning anxiety isn't a diagnosable medical condition, it still sits on the spectrum of anxiety, and it doesn't mean that you don't deserve help. Number 5, anxiety affects both your body and your mind, and understanding that link helps you break the cycle sooner. I hope this video gave you clarity, reassurance, and genuine help. Remember, as always, my videos are not personal medical advice. I don't know you, I don't know your individual circumstances, and nothing replaces a one-to-one conversation with your doctor or healthcare professional. But if you found this video helpful, please like it, subscribe to The Health Perspective, and drop a comment below. Tell me what parts resonated with you or what questions you want me to cover next. It helps me shape future videos and helps these conversations reach more people who might actually need to hear them. And if you like this video, check out my one on propranolol, the overlooked medication for anxiety. Thank you for watching, take care of yourself, and I'll see you in the next episode.